Hello, a very warm welcome to Middle East Matters. I'm Sanam Shantier. This week, the team and I are bringing you a special edition of the programme focusing on the impact of COVID-19 on the region. Coming up on the show, Israel sees a rise in the number of infections amid draconian measures implemented to stop the spread of the virus. NGOs step in to provide relief packages for vulnerable communities. 5 years of war in Yemen and one of the world's gravest humanitarian crises. The impoverished countries now bracing for the coronavirus pandemic will be speaking to one NGO about the situation on the ground. Plus, Turkey steps in to battle COVID-19 with a secret weapon, one that's found in almost every household. That's cologne, and the sector is now experiencing a boom. Thank you so much for watching Middle East Matters. We start with Israel, which has taken a plethora of draconian steps to tackle the spread of COVID-19. Among them, requiring a 14-day quarantine for anyone entering the country and even monitoring the mobile phones of people with suspected coronavirus. NGOs, for their part, have stepped up to offer support to the more vulnerable communities. Here's a report from our team on the ground.
It's a special project. People drive up to collect packages, but not for themselves.
So
we wanted to do something good, so we just came and we're bringing food to elderly people, bringing it upstairs, knocking on the door and going out. I think Israel is very ready for this kind of situation. We know how to handle stuff like food, security, so we hope we're going to help some people. It's going to be a good day.
Israeli NGO Latet, To Give, is organising this, and it plans to distribute 15,000 packages. The army's also here. It's made this military base in central Israel available for the project. Each package contains enough to last 1 month. Chickpeas, tuna, tomato sauce, and also toilet paper and gloves.
Et nous sommes en fait l'expression d'une formidable chaîne de solidarité. L'ensemble des fondations philanthropiques, des milliers de volontaires nous appellent chaque jour pour prendre part à cette opération. L'ensemble des grandes sociétés israéliennes est avec nous et je crois que c'est porté par cet élan que nous allons réussir en quelques jours à mettre en place une des plus grandes opérations de notre histoire.
Tamara is among the volunteers. She and her friend are both out of work due to the pandemic.
On a fait le plein, on a reçu les adresses, donc on va y aller.
They wear a mask and gloves and know they must keep to a distance of 2 metres. But when they arrive, things don't go to plan. It's not the senior citizen who opens the door, it's their helper.
Elle nous a demandé d'entrer et de lui mettre le paquet à l'intérieur. En principe, on n'est pas supposé rentrer. Le fait de ne pas pouvoir toucher les gens, dire bonjour, serrer la main, embrasser quelqu'un, je pense que oui, ça fait beaucoup de peine, ouais.
They've learned a lesson, and the next delivery will be in compliance with the rules. People over 75 are more vulnerable to the coronavirus. They're also amongst the poorest in the country.
Let's turn our attention to Yemen now, which last week marked 5 years of conflict, a deadly proxy war between the Saudi-led coalition and Iran-backed Houthi forces, which has left millions suffering. In fact, it's been dubbed one of the worst humanitarian crises of our time. That's 16 million people in dire need of clean water, sanitation and hygiene. Now, last year, Yemen was hit by the worst cholera outbreak in modern history, and today it's bracing for the coronavirus pandemic. For a clearer picture of what's happening on the ground, I would like to welcome Tamouna Sabadza to the programme. She's the Yemen country director at the International Rescue Committee, and she joins us from Tbilisi. Thank you so much for being with us. The fear that we have for Yemen is that it's already a breeding ground for disease. We saw that with the vast and rather deadly spread of cholera. Tell us more about the conditions on the ground, if you can.
Thank you for having me. Yes, I agree. This is actually a nightmare scenario for Yemen. And as you correctly mentioned, We have just marked the 5 years of the war in Yemen that has left the basic infrastructure and economy devastated, and this is affecting millions and millions of Yemeni lives. 80% of the Yemeni population, which is roughly 24 million people, are in some kind of in need of some kind of humanitarian assistance, and no surprises there that it has been dubbed as the world's largest humanitarian crisis to date. I can think of very few countries that can be less prepared than Yemen today.
You just mentioned that the economy is devastated. We're also talking about a country here where households are already lacking basic services, where the healthcare system is already extremely fragile.
It is, and more than half of the health facilities in Yemen currently are not functioning. Educated doctors and nurses, a lot of them have fled the country, and those who are still in country have not been continuously paid for 2 years. So IRC, for example, is incentivizing such medical personnel in the health facilities that we support. Currently, we do not have the confirmed cases of COVID-19 in Yemen. However, there are fears that by the time it is first discovered, it would have already spread in the country. Yemen ranks in the bottom 5 of the 195 countries and territories assessed by the Global Health Security Index. To cope with such scale epidemic outbreak. Yemen is really not equipped to deal with such an outbreak.
Now, you just mentioned that a large number of doctors have actually had to flee the conflict. Can you talk us through what NGOs like the International Rescue Committee are doing today to help prepare for the arrival of the pandemic? And frankly, will these levels of preparations be enough?
Yes, of course. So International Rescue Committee has already started training the health workers on recognizing the disease and identifying, isolating the cases when it comes. We are also actively engaged in the awareness raising about the virus and the prevention measures among the population. We have started replenishing our stocks of hygiene supplies to help prevent the spread of the virus. This will be distributed among the populations, as well as we are working on the cash distributions, because, as you know, the impact of this virus is not only on the health of the people, but also there's an economic impact, and households usually refer to the negative coping mechanism and reducing the meals and the stop of the income. So we are trying to address this by the cash distributions.
Now, lastly, the US has just cut millions of dollars in healthcare programs and aid for Yemen. Surely the impact of this is going to be devastating, especially at a time like this. Very briefly, if you can respond to that question.
It is true, and right now Yemen needs more funding, not less funding, to help address the impact of this outbreak. What is important is that the warring parties work with the humanitarian agencies like IRC and all the other international organizations to ensure that the aid reaches those who need it. And this will also trigger the donors to increase the funding and give us the support we need to prevent this disease from taking more lives than absolutely necessary.
Indeed, devastating political decisions that are being taken by the international community. Tamuna Sabadze of the International Rescue Committee, thank you so much for speaking to us here on Middle East Matters. We end with Turkey, where people have come up with their own method of warding off even the virus. They're using something that's already on almost every bathroom shelf. That's cologne. Now, since the 19th century, cologne has been used to freshen hands, and it's usually offered to guests in private homes and restaurants before and after a meal. But Turks are now turning to the product to keep the virus at bay. As France 24's Shona Bhattacharya and Ludovic de Foucault explain, even the Turkish government is recommending this method.
Bazen tur atıyoruz böyle, müşteri çıksın diye. Ama maalesef bütün sokaklar boş. Gördüğünüz gibi
For Ali, a taxi driver in Istanbul, times are hard.
Yani kiram var, elektriğim var, suyum var, şunun var. Bunlar ödemek zorundayım. Çalışmayınca da olmuyor.
Ali is less than 65 years old. He isn't affected by the confinement measures, so he's got to keep working. To protect himself from the virus, he uses a very Turkish elixir, cologne.
Ellerimize böyle sıkıyoruz. Bazen içeriye sıkıyoruz. Müşteri binerse eline sıkıyoruz. Yani normal. Gerektiği kadar korunmaya çalışıyoruz. Ama nereye kadar korunacağız tabii ki bilmiyoruz.
Cologne arrived in Turkey in the 19th century. Since then, it's been adopted by the general population. These days, specialty stores are seeing a record number of clients.
Bayağı güncel oldu kolonya kullanmak. Bol bol kullanıyoruz kolonya.
Koronavirüs olayından sonra satışlarımız %200'lere varan bir artış oldu. Yani. Çünkü kolonya kullanmayan da bunun dezenfekte ettiğini, işte mikrop kırdığını öğrenenler kolonya almaya başladılar.
Cologne isn't viewed as just a cosmetic product anymore. It's also sold in pharmacies, where it's become hard to come by.
Bizim kullandığımız kolonyaların içinde en az %70, %80 civarında alkol var. O alkolün de içinde dezenfektan etkisi var, antiseptik etkisi var, dezenfektan etkisi var. Yetmez. Diğer şeylere de dikkat etmeleri lazım. Mesela uzak durmaları, ondan sonra birbirlerinin eşyalarını kullanmamalarını, öyle temizliğe yani hijyene dikkat etmeleri lazım.
A common staple in many Turkish households, cologne has gone from novelty item to essential ally in the fight against COVID-19.
Well, that's it for us this week. Thank you very much for watching Middle East Matters. Do stay tuned. At France 24, our goal is to follow the news around the world as it develops and keep you informed at all times.
The coronavirus pandemic is hitting us all hard, not just in France, but everywhere. We at France 24 are determined to provide you with reliable and verified information as the world confronts the biggest health crisis for a century.
Wherever we are, however best we can, we're trying our utmost to keep on bringing you the very latest news.
France 24 is on the ground, reporting from the field in English, French, Arabic and Spanish. Keep watching and reading on France24.com.
France 24, our mission is to inform you.
Liberté, égalité, actualité.